Hi everyone, Sue Reed, Psychologist here. Today I am taking you through part 2 of my joint series. For part 1 of the joint series, which is the upper body, you can refer to my clip on YouTube. And today we're going through the lower body. Now this series of practices focus on very simple movements for joint mobility. They are referred to as the anti-rheumatic group, or in yoga called the Pawan Muktasana series. What that means is wind releasing pose. Now that is not what you think. What it means is releasing stuck energy, lymphatic fluid, and build-ups that happen through all of the joints in the body. That can come from sitting too much, from bad posture, from not moving enough, and we get a lot of things stuck into the joints, and that can lead to pain, to chronic pain, to tension. So this is a very profound series of practices that, when done regularly, can really transform the way you feel. It has a big impact on the physical body. It also helps with mental clarity and removing mental tension. What I love about it is literally anybody can do it. You could sit up at bed in the morning and go through these movements for the upper body or lower body, or as you get more proficient, you can work right through the whole series in about 15 minutes. Certainly when it's cooler and colder and you're getting stiff and sore and a bit more removed from the outside world, this is a great series of practices just to really re-enliven the body and awaken things. It's great preparatory practice if you haven't done some exercise for a while, if you're thinking about doing more movement or yoga-based practices. This is great preparatory work to make sure that your joints are ready. So we're doing this as a follow along. As I said, you can look at YouTube for part 1, and today we're going through part 2, which is the lower body joint series. So all of these practices can be done on the floor in what's called the base position. So in the base position, we have our legs outstretched. I do like to sit on just a small blanket, not a really thick cushion, but also to open up the base of the pelvis or the hips just by moving it apart, laying the legs out in front, and then we pop the hands just behind us, open up the shoulders, lean slightly back but with a straight spine. This is called the base position. It's a fairly relaxed position, and it's often the pose we move back into between every 1 or 2 practices, just to notice, what does it feel like in my knee, in my ankle, in my toe. So we sort of reset here before we move to the next practice. And just to show you what that looks like from side on, here my legs are laid out in front, arms just behind the hips, opening up the shoulders and the elbows, and I'm just leaning back slightly, but I'm not doing this. We go. Nice open posture there. So when we start this series, it's really nice just to settle the body. So you might start in the base position and just take a couple of slightly deeper breaths, or even just notice what your natural breathing rhythm is. And as always, if you'd like to block out a little bit more of the input from the rest of the world, we can lower the gaze of the eyes down to the floor, or even close the eyes if that's appropriate for you. And just notice the rhythm, the pace, and the depth of your breath. Are they shorter, shallower, more chest-based breaths? Or are they deeper, slower, more belly-based breaths? You might deepen the breath slightly just for a couple of rounds of breaths, and just notice what it feels like in your body at the moment. And throughout this practice, we're going to be bringing our mental attention and focus into the physical body. We're starting with the first joint of the lower body, which is the toes. So we're bringing mental attention and focus into the toe joints. These are often overlooked, but these tend to stay very squashed. In our shoes all day, we put a lot of pressure through our feet, and we rarely give them any attention. And the toes and feet have quite a strong relationship with brain health and the opposite hemisphere of the brain to the side of the foot we're working on. So if we're starting with the toes, we pull the toes back towards the body or towards the ceiling so they're facing upwards. Now we're not bending the ankles, we're starting with what's called toe bending. So as I exhale, I'm trying to squish the toes. You'll notice my toe joints are not great at this. I need a lot of practice. And then as we inhale, we extend the toes. So we close, open, close, open. And we're continuing for between 6 to 10 rounds. So close. I suspect most people's feet are better than mine at this. So close, open, exhale, inhale. My mental attention is on the toe joint and on counting. So counting the rounds that I'm doing, inhaling, exhaling, slight pause and rest. For the next movement, we are taking our attention to the ankle joint. Similar, sitting in the base posture. And for the ankle here, we are pulling the toes towards the nose as far as you can, and then pressing the toes down towards the floor. Remembering that mental tension often gets held in the physical body. And as we work through the physical body, we notice mental alleviation and peacefulness and processing as we start to move this tension through the body and the mind. So inhaling, exhaling. Inhale, exhale. Once you're comfortable with the movements, you can close the eyes, bring the attention right into the ankle joints, becoming familiar with your own body. Again, 6 to 10 rounds. I'll do one more. Slight rest. Keeping the awareness in the ankle joints. The next one is ankle rotation. For this, we are rotating the ankles together at the same time. So this helps with our sense of proprioception, which is our understanding of where our limbs are in space, as well as coordination. We are rotating the ankles at the same time clockwise. So we rotate around and up, exhaling as we rotate away, inhaling as we pull it back towards the nose, exhale. And once you've got the hang of it, you're just focusing on the breath, the joint, and the counting. So we're counting 6 to 10 rounds in one direction. I think that's about 8. Slight pause and moving in the anti-clockwise direction. So you can look at the ankle joints if that helps you get better awareness of it. Again, we're wanting to keep the spine quite straight. Similar number of rounds in the opposite direction. Slight pause, and we're always wanting to notice. Part of what mindfulness is observing and noticing the body, the breath, the emotion, the mind. Ankle crank is another movement we can do for the ankles and also for the toes. So movement of the toes is quite important as well when it comes to freeing up energy in the body. So we are going to take the right foot, bend it at the knee so the heel is up towards the buttocks, and then we take this right ankle across the left thigh. I like to pop my fingers just in between the toes. If you've got any tension, this is quite painful, which is an indicator that we need to do more of it. So we try and squish the toes the fingers right down to the base of the toes. For my little feet, that is quite hard. Then I push the heel of the palm into the ball of the foot. With the leg crossed over, we just rotate the ankle bone using the arm. So we're just rotating here. And again, depending on how much time you have, you might just do 5 in each direction, might be 6 to 10. At the end of the day, this is really nice to do just to alleviate all the tension build up in the foot. And then we rotate. And it is really nice here just to even work the thumbs through the arch of the foot. You can press both thumbs into the ball of the foot. We're getting a bit of movement through here. This helps alleviate quite a bit of tension through the body. We bring that knee up, then extend the leg out. I can already notice the difference just from that little bit of work on there. And the left side, so we bend the knee, cross it over the right thigh, pop the fingers right through the toes. Again, quite excruciating for some of us. Some people are absolutely fine with this. And we pop the heel of the palm right up into the ball of the foot, and we do these ankle cranks. And we're cradling the knee here in the leg, or we're holding on just above the ankle. So we're rotating. And again, if you've had a lot of ankle injuries, you might hear a lot of snap, crackle, and popping. In here, the opposite direction. Five to 10 in each direction. Then a little bit of massaging through the arch. There's the main arch in the foot, and then there is another arch right in the center there of the ball of the foot, which helps you bend around the foot, and this helps alleviate quite a lot of tension through here. Anything really that you can do is quite helpful. Bring the knee back to the center, extend it out. That's very noticeable. The next joint in the lower body is the knee joint, so just bringing your mental attention and awareness into the knees. And we're going to start with the right knee, taking the hands and clasping them behind the hamstring, behind the thigh. The arms do quite a lot of the work here, and the core. The leg moves fairly passively. So we sit nice and upright, we lean back slightly, and the leg will naturally come off the ground here. Just to show you that from the side, clasp behind, sitting nice and upright, clasping the leg. And this works on the digestion tract, so on the upper portion of the digestion on this side. As we bring the knee to the body, we are sitting nice and upright. We're going to take a breath in, and as we exhale, we pull the leg and the thigh right up to the abdomen. Now my arms are doing most of the work here, so we're working on the knee joint, and the arms are extending as the leg extends. So exhale, inhale, exhale, inhale, and keeping that awareness in the body. If your mind wanders off, that's really normal. We're just wanting to notice that the mind's wandered off and bring it back to the body, the breath, and the practice of being here and being present. And you'll work out the right rhythm for you to match with your breath. So it's around about 8 rounds on that side. We're going to do the next knee joint practice on the same leg. So on the right leg, hands clasped behind the thigh, sitting upright, leaning back. Now this is called a knee crank. For this one, as we breathe in, we're trying to make a circular movement with the foot, which will rotate the knee joint. Now for you, if there's been significant injuries, it might be very small. Over time, I've seen people really improve their knee joint movement with regular practice. So here, breathing in as we raise up, breathing out as we lower down. Inhaling, exhaling. And something we don't get a lot of time to do, which is just not be distracted and bring our attention into the present moment. So we're going to try around 5 in that direction, and then 1, 2. So this is increasing some strength in the core and the upper body. So hold myself upright. 4, I think 5. Laying that out, resting in the base position. And just notice, what does it feel like through that right leg? You might notice a bit more warmth, tingling, movement in the knee joint, the ankle, the toes. Moving the attention to the left side of the body, the left knee, clasping the fingers and the hands behind the left thigh, sitting nice and upright. We are going to take a breath in. As we exhale, we squeeze the leg into the left side of the abdomen. We exhale as we extend. Again, the arms are doing a lot of the work here. So usually for 1 month each year, I try to do this every day for 1 month of the year. And I usually start feeling quite stiff and sore and holding a bit of tension in my body. By the end of the month, my body feels incredibly different. And I'm always battling my mind thinking, gosh, I should be doing something more difficult. How could this be doing anything? But as I said, I really encourage you to try it consistently and notice what a powerful effects it makes. Some cracks and pops. And it does have a positive impact on the digestive system as well, especially with these movements where we really squeeze it into the abdomen. Giving that a rest for a moment. And the same position for the knee crank. We squeeze that in and we are rotating. So we are going to go clockwise to start off with. So rotating. And as you become more comfortable with this, you may do these much quicker. And that's fine as long as there's mindful awareness and attention. My very experienced yoga teacher, who's been doing this for about 60 years, every morning she does these. I think she's about 80 now. And in her bed, she calls it bed yoga. She moves through these quite rapidly. And she is incredible in terms of her capacity to move and still be quite fit. Inhale as we raise up. Exhale as we rotate down. We'll do one more for good luck. A slight pause between the movements. So transition in traditional yoga, we always leave a little moment just to let the effects settle into the body. And we're moving up to the hip joints now. So awareness and attention comes into the hips. We're going to bend the knee and bring the heel back towards the hips again. We're going to take this right ankle across the thigh or place the foot right on top of the thigh. Or if that's too difficult, just pop the foot inside the left leg here. We are working on the hip and the adductors. So wherever is comfortable for you, again, the arms do a lot of the work and the hip is moving passively. So we take a breath in. We inhale as we raise up. We exhale and we're just going to gently push this down. Now your range may be very limited here. And I've seen people start like this and over time, even in the course of a month, their leg drop right down. So you might just be here. You might be able to squeeze it all the way up into the abdomen and then press it down, holding onto the ankle, pushing up, down. If you're able to cross it over here, you might raise it up. So inhale, exhale. Again, 10 times each side, 6 to 10 times is plenty. What's really important here is more the regularity of which you do that. So if you do 6 rounds on each part of the body, but you're doing that every day, that will accumulate very rapidly. And again, we want to make this doable. We don't want to feel like it's a chore. You want to notice the benefits and be encouraged to keep doing it. So then we bring that down. We're just trying to protect the knee by coming into this in the correct way. So we're not moving straight out to there. We're coming up to the center, helping take the leg across the body. Sitting nice and upright as I inhale and exhale, press it out. So it's like a little set of bellows, like we're breathing in, out, in, out. And we do tend to get very tense and tight through the hips. One of our major stress muscles here, the psoas muscles, the hip flexors, get very tense from all the sitting that we're doing. So this can lead to a lot of emotional release actually as we start to work through the hips over time. Just got my breathing wrong there. Exhale, inhale. Then we lift the knee up, bring it back into the center. We extend. Notice what that feels like. And then we move into what's called full butterfly. Again, bending the knees up together. We bring the feet together, soles of the feet together. Let the hips come out to the side. Now it's nice to anchor the feet by holding on here to the toes, clasping them so they don't slide away from the body. And then we are going to just very gently start to rock the legs. And again, be mindful of where your body's at. This may be very, very small butterfly wing movements. So the recommendation is to do this anywhere from 20 to 50 times. So again, however much time you have to do this, it's quite fun. What tends to bring pain into the body is lack of oxygen flow and lack of blood flow, which occurs when we're too sedentary. So again, pain, stiffness is usually an indicator we're holding emotions, we're holding stuck stress, or we're just not moving enough. So we're bringing blood flow in, oxygen, and then the lymphatics through movement start to help move toxins and built up hormones and chemicals in our body back out of the body. So anywhere from 20 to 50 times. And then we're going to give this a little bit of a help by pressing the elbows down into the insides of the thighs and then pressing up. Up with the hands, down with the elbows. Up. Inhale as we go away. Exhale as we come up. And you might like to finish that one with a few more little butterfly wings out here. Taking that, bringing the knees together, extending them out. Notice what that feels like. And then my personal favorite for the hips, hip rotation. We will start on the right leg again. For this one, we are bending the knee, bringing the heel back towards the hips. We're taking the foot across the thigh again, and we're cradling the leg almost like you're cradling a little baby. We've got one hand here holding the ankle, one hand holding behind the knee, and we are going to rotate the whole leg in a clockwise direction, then anti-clockwise. And then again, the arms are doing a lot of the work while the hip stays fairly passive. So we're getting movement and flow through there. So we hold and clockwise, Now this will look very different for everyone depending on what's being held in your hip. So it's like a little baby. I'm rotating the whole leg around, out, up towards the digestive system, the abdomen, across and around. So one more time in this direction, slight pause, and then in the opposite direction. I really like the effect this has on my digestive system. I find when I do it regularly, everything just starts working a lot better. Get better movement, better flow through the ascending and descending colon, so through the digestive tract. Really, I can already feel that hip joint opening up from where it was at the start. Again, important to protect the knee. Place the foot on the floor, knee back in the center, extend the leg, and you'll really notice the warmth start to be generated through the joints there. And the left side, bending the knee, placing the foot onto the side of the thigh, cradling, right hand under the foot, left hand under the knee, sitting nice and upright, slightly back, and we're going to rotate in a clockwise direction as far across. What you really start to notice as you do this and become aware of your body is any differences between the left and the right side. Obviously, if you've had surgeries, injuries, you really start to notice that difference in symmetry, which is important when it comes to function. Over time, as you practice, we really want to see these differences starting to equalize and getting better symmetry, which tends to lead to better movement and function through the body. I'm exaggerating the breathing a little bit so you can notice. We inhale, exhale. I like to exhale as I press up against the abdomen, pause, move in the opposite direction. I can really notice the difference in the tension on the outside of this hip, on this side. And again, you just work with your body. Whatever movement is possible, what we're noticing is change over time. One more for good measure. And then lifting that back into the center, extending it out, coming into the base position. And I really want you just to notice, what does it feel like through the joints of the lower body? The toes, the ankles, the knees, and the hips. Tingling, warmth, these are all indicators of movement. Blood flow, oxygen, lymphatic flow, energy flow. Taking a couple of breaths, noticing where you're at. And you might like to bring the palms of the hands together, particularly if the eyes have been closed. We're going to do this practice of palming where we pop the palms over the eye sockets, blinking the eyes into the palms of the hands, taking a nice big stretch. And that is the end of our lower body joint series. Really nice to combine it with the upper body joint series. Please give it a go and let me know in the comments how you're finding it, what changes you notice in your body and your system. Thank you so much for watching.